Years ago, when I was 19, I had a car accident. I was rear-ended and had a really bad whiplash injury. And for 35 years, I've had headaches and just some ongoing issues. And about 5 years ago, I got to where I couldn't even turn my head to look over my shoulder to try and get on the freeway. And it just got progressively worse. I couldn't really turn my head very well. And so I'd seen doctors in the past, and they had told me, when it gets bad enough, come back, we'll do surgery. And I really didn't want to do that. So I was just kind of looking for an alternative.
Well, first off, we have to start by saying that there's a lot of conditions that are asymptomatic. In other words, they don't have no pain. And that's usually how degenerative joint disease starts. It starts very slightly and gradually start increasing. However, during that process, it doesn't hurt at all. So she's a very good, a typical patient which has gone all these years trying to convey with the pain and not really getting anywhere.
I noticed the very first treatment, I had a huge change. I could actually turn my head better. My shoulders were more relaxed. And it's taken a long time, but he's gotten to me to the point where I haven't had headaches since I've started seeing him, which has been a huge thing for me because it used to be I always had headaches, and now to just not have that burden anymore, to not have to be taking Tylenol or something all the time. He's gotten to me where I can actually move around a lot better and just having a better life, and that's made a huge difference.
This particular case. This lady had a lot of degeneration going on in there, a lot of restriction. She couldn't move, she couldn't turn her head, a lot of headaches. And I saw why, because there was a lot of advanced degeneration in her neck. So when we started treating her, we used different modalities and different approach to try to stabilize her and try to get her to a level of sustainable relief.
Well, I wouldn't be able to move around as well. I wouldn't be able to function without headaches the way I do now. So he's really made a big difference in my life.
Right. Well, you know, that's the philosophy of chiropractic. That's why we don't prescribe medication. We do understand what medications are out there to treat pain and deflammatory medications as well. We know what medications are, but we definitely don't use any medication. We have other alternatives that we do in cases when they have acute pain per se, for instance. In very, very rare occasions, I have to use medication through a medical doctor to reduce the pain, but that's very, very seldom. We're able to manage and to decrease the pain very, very quickly in our office without medication.
I probably haven't told him enough, but he knows because I come all the time. I'm still coming to him, and you know, I haven't found anybody else that's as professional, and they've just really treated me well here, and I'm very happy with my care here.